Tick, tock, tick, tock, tick, tock, tick, tock.
Just give me a little more time.
Push. Too soon. Try again. Time's nearly up.
Tick, tock, tick, tock, tick, tock, tick, tock, tick, tock.
Whoa! Whoa.
We can't be starting from here. It doesn't make any sense. We have to go back to the beginning.
Michael, come here.
What is it?
Come here to me, and I'll tell you.
Okay. What's the big surprise?
I'm pregnant.
Oh, God. Oh, finally. Oh. It's happened?
Yeah.
I love you. I'm happy.
I know, me too. Finally.
You should get yourself checked out. Let's make an appointment for you today.
Oh, come on. Hang on a second. It's 7 o'clock in the evening. I'll call into the GP in the morning.
Nice. After last time, you know, I just want to make sure it's all okay. That you're okay.
Yeah, I know. And I've been thinking about that too, especially after last time. But I'll call into the GP. He can book an appointment at the hospital, but just let's, take things slowly. But I'll tell you what, I'm going public this time. I don't see the point in getting a consultant when you don't want one.
But do you think that's wise? I mean, I know things are tight with your mortgage and all, but we need to get you looked after.
Well, you don't necessarily get that from doctors, do you? Do you remember the one I had after the miscarriage? I have never felt so utterly disregarded. He just treated me like a number on a form. I was there with floods of tears going down my face, and I want someone who will treat me as a person, not just a number.
I know, but that was just one doctor. There's bound to be a few that don't have a good bedside manner. You can't let that put you off all doctors.
But he didn't even cancel the hospital appointment. Do you not remember? They rang me up. It was like reliving the whole thing again. No, thank you. But the midwife, she was amazing. She was kind, she was positive. So if I have a choice, I want someone like her this time.
Maybe you're right. The important thing is that you're healthy and happy, eh?
Yeah, thank you.
Let's not go jumping ahead and looking for trouble.
Thanks.
It's brilliant.
I know.
It's going to be fantastic this time.
I'll ring my mum in the morning. But let's not tell anyone for a while, okay? Until we know everything's okay.
Welcome. Welcome. Thank you for coming. Now, as I'm sure you're all aware, Ireland is one of the best and safest places for women to give birth in the world. We have the technology and expertise in place to make birth a safe and rewarding experience. Just put yourself in our capable hands.
We have the technology, all right, but do we have the staff? Every year we lose more and more doctors and midwives. Nobody wants to stay anymore.
'Tis true there have been a few unfortunate incidents, but I can assure you we have everything under control. We have systems in place that guarantee the well-being of our patients. Here in Ireland, we have centres of excellence, maternity hospitals that provide the best and safest birthing option for women and their babies.
I think women are very capable. All they want is someone to support them, to talk to them. And not everybody lives close to a hospital.
Women want to know they are safe in the care of their consultant. We are trained to the highest possible level and will monitor every aspect of your pregnancy.
I suppose if you think all that checking up actually helps women.
Here in Ireland, all members of the medical team work together to find the most appropriate level of care. My job is to find strong leadership and clinical oversight, and to make sure all staff members are on the same page and maintain their place in the system. Women. Women of Ireland, fear not. Fear not the pains of childbirth, for we, the glorious obstetric consultants, are here to save you from your risky, unpredictable pregnant bodies. Just follow our directions as you would the word of God. And all, I assure you, all will be well. Only we can know the dangers you face, and we will make your safety paramount. Women-centred care has its place, no doubt, but one only has to turn on the television or pick up a newspaper to see the fate that awaits all those who heeded not to the voice of medical authority.
In days of old, when doctors were bold and did not wash their hands, the powers that be began, you see, to overhaul birth in these fair lands.
We started with those who could pay, then the state began to pave our way. Bright light of reason to holiness season brought science to the masses. Superstition was undone, birth at home was totally overrun. The role of the midwife eclipsed by the light of the medical classes.
We exchange sacred words from white written cells, and we reap what has been sown. Rounded zones of family homes, any work can be done by women alone.
Tides are totally under our domain as we wage the medical campaign.
Oh, the medical model is a very fine thing, makes the consultant a virtual queen. Counts for every miss, ensures nothing's missed. It's
In the Constitution, women obey the institution. I decide when and where, get them in on the clock. We will make you, we will make you, we will make you safe in our care.
Please take a number from the kiosk by reception. Number 125, please proceed to window 2.
Excuse me, oh, Jesus, sorry. I'm wondering, is this seat taken? Oh, you're keeping it for your husband. Oh, lovely, lucky husband. What? I wasn't cutting ahead, I was just asking. Oh, never mind.
Ticket 202.
Great. And I thought I got here early.
I suppose I won't be getting back to work anytime soon.
Please take a number from the kiosk by reception. Number 127, please proceed to window 2. That's the system, love. Let's get you registered and then we can talk.
God, it's really strange being back in the waiting room. Waiting for them to tell me what I already know. That I've the start of a little person growing inside me. The smell of the place takes me back. The old paint, the dusty paper, the hand sanitizer, the nervous excitement, tension of waiting. I can feel all the women who've sat here before me, like they're soaked into the grain of wood. The place is packed. Women jostle for seats. Some with their partners, others with toddlers on their laps trying to quieten them, but we all try not to miss our names being called. I have a knot in my stomach. I really want someone to listen to me this time, to know and understand how important this is for me. Michael's great, but he always tries to fix things. He fusses, and my mother, tricky. This time, I want someone to see me as a person, not just a number.
Number 202, please proceed to window 2.
Hello. It's busy today, isn't it?
Sure, half of Dublin is here. I'm Fidelma, a midwife here. How are you?
Good. A little nervous, but I'm okay.
Don't worry, we'll take care of you. Name?
Evelyn Murphy.
Date of birth?
3rd of July, 1979.
Is this your first pregnancy?
I had a miscarriage a few years ago.
Oh, I'm sorry to hear that. When was that?
August 14th, 2014. I was about 7 weeks along.
No subsequent pregnancies then?
No.
Don't worry, we'll take care of you. Just a few more questions. Date of last menstruation?
16th of July.
Are you married?
No, I live with my partner.
And have you informed your partner of your pregnancy?
I have, of course.
Just have to tick the boxes. Any sexually transmitted infections?
No.
Nearly there. Any history of diabetes or heart disease?
No.
Religion?
None. What has that got to do with anything?
Just another box to be ticked. That's you registered. Come with me now and I'll check your urine sample and your weight and your blood pressure.
Will I be seeing anybody today to talk about my care?
Yeah, you'll be in it with the consultant today and they'll talk to you about your care path.
Still, I didn't really have a good experience with the consultant I had the last time. I was really hoping to speak with a midwife. Can't I just talk to you?
That's the way the system is set up. You just have to see a consultant first and they'll discuss your care path with you. If they decide you're low risk, you can stay with the midwife.
Low risk? No, like low risk of what?
It depends on how you look at it. A female body is a mystery, totally rife with pathology. The consultants rely, you see, on your medical pathology, and your life inside can make your body unstable. That's why you're going to his examination table. Risk doesn't take a clear form until after the baby is born. Proportionate or absolute, they match the statistics as soon. And if a paper puts you on the list, a pregnant woman is one big risk. If your blood pressure's up and your blood pressure's down, you have diabetes or a blood ultrasound. Female body is a mystery, totally rife with pathology. From here to there, the consultant will search everywhere to find an excuse to put his skills to use and then endure. And any previous complications, forget it, he'll get you for sure.
Evelyn Murphy?
Here. It's Evelyn.
There we are. Now, you just make yourself comfortable. I'll have a look.
Sorry, what was your name?
Mr. McGovern. Now, I can tell you that your blood and urine are perfect. Your weight is fine. However, I do anticipate problems further down the line when Mum is over 35 on the first baby.
We have been trying for 3 years.
You know, fertility does decrease from as rapidly and as young as 32. I do wish women would take their fertility more seriously. It places a tremendous burden on us, and there's only so much that we can do.
If everything is okay, can I be seen by a midwife?
Well, hold your horses. Now, given your age, and I think I saw something about a miscarriage there, together with your difficulty conceiving, makes me think that we need to keep an eye on you. I think I should look after you myself.
Well, you just said that I was low risk, so I can be seen by a midwife?
I do, of course, have the utmost respect for my colleagues in midwifery, so if that is the course of action you want to take, then that is what we will do for now. However, though you are low risk at the moment, this could change overnight, and it could be the case that consultant-led care may be the best course of action for you in the future. So think about that. Right, that's you registered. Off you go.
Well, how did the appointment go?
Good. Everything's okay. According to them, I'm in pretty good shape for a lady of my age.
Oh, never mind that, you're glowing. How far along are you?
I'm about 9 weeks. Everything's fine, but I'm really scared of getting too excited, so, I can't let myself believe it's actually happening.
I know, it's very hard having lost a baby and then waiting so long for another, but the excitement will come. Have you spoken to them in work about putting you on to...
I have, and it's fine. Please stop worrying, Mum, because I'm certifying buildings, not making them myself.
My daughter, the engineer, in my days, ladies didn't do that kind of work. I just think it's no harm to take things a bit easy.
But, Mum, I've talked about this before. We both have to work to pay the mortgage, and look, besides, I'll be on maternity leave towards the end.
I know you think I'm old-fashioned. It's just that I worry about you. But please God, just it'll be up to your eyes in nappies and night feeds.
Thanks, Ma'am.
Paying you back for all those sleepless nights you gave me.
Very good.
Tell me, what consultant will you be seeing?
I have an appointment with the midwife next month.
But won't you be seeing a consultant? If it's a matter of money, I can help you out. It is my grandchild, after all.
Ma'am, you're very good, but it's really not about the money. I'm just happier with the midwives. They don't bury their head in your chart.
But so many things can go wrong. You know that yourself. Wouldn't you be better to have expert care? Did I tell you your cousin Orla went private and she had a really good experience?
Who did she have?
I think it was a Mr. McGovern. She couldn't speak highly enough of him.
Well, I had him for the assessment, and I really wasn't that comfortable with him. I'm happier with the midwives.
But won't there be midwives there, working under the consultants? Surely you can speak to them. But the consultant is the real deal, and you deserve the best, don't you? You could always ask for a lady consultant. I know I would have preferred that if there'd been any around back then.
But do you know what? Not every consultant is perfect. What about that one up in Drogheda?
That's not fair. If you'd seen what I'd seen growing up, you'd be happy to have someone with proper medical training. Birth can be a dangerous thing. That girl who died having the baby all by herself, you were only young then, but it broke my heart. I was lucky to have good medical care. I don't know what I would have done had I not been in hospital with you.
I'm sorry, Ma'am. What was it like having me? We've never talked about it.
Well, you know, I had my own disappointments before you came along, but we didn't talk about that kind of thing back then. We were just expected to get on with it. But I was very nervous, and with you, it just felt different right from the beginning. It just felt right. And your father, God help him, he wasn't any use, even when he was around. So when the time came, I just went in by myself and, well, I was your age, good old days, doctors really had their ways. At the first contraction, you'd be out of action, drifting in a twilight haze. The doctor would do what needed to be done. Nurses would bring you a tea and a bun.
That's the way it used to be. Sorry it was hard when you had me. Now women have a say, not just listen and obey. I want a midwife with trust and support. The hospital should be a last resort.
There was many a soul had to go it alone, lying in a grotto on a bed of stone.
It's for me to decide who I want by my side. Women have choices, we must raise our voices. It's for me to decide
Needed to be done.
who I want by my side. Women have choices, we must raise our voices. It's for me to decide
Needed to be
who
done.
I want by my side.
Tea and a bun.
Women have choices, we must raise our voices.
There was many a soul had to go it alone, lying in a grotto on a bed of stone.
It's for me to decide who I want by my side.
Dying in a grotto on a bed of stone. Into your head, baby is safest in a hospital bed. I'm delighted to tell you the scan was absolutely fine. The baby looks great. Have you any questions?
I've been hearing stories from friends and I've been reading up on all the books about diet and exercise, but there's a lot of conflicting advice out there.
The important thing is to listen to your body, eat well but not for two, and be sensible. A little gentle exercise will do, but no heavy lifting. And that includes hoovering, by the way.
Hoovering! I'll be sure to tell Michael that. And I know I'll be seeing you between GP visits, but I wanted to talk to you about my birth, or planning the birth. I want to have a natural birth, no drugs, lots of moving around.
Well, if there's no complications, there's a domino scheme run here by the midwives. And you may not necessarily have the same midwife, but you'll get someone from the team. And after the baby's born, once both of you are well and healthy, you can go home within 24 hours, and one of the midwives will check on you both at home.
Oh, that sounds great.
So let me get you checked in there for your next appointment and scan. You can have a look at the delivery suite and the birthing room when you come to the antenatal class, and bring your partner. It'll be good for them to see where you'll be on the day.
One more question. Should I be like making a birth plan?
Well, it is early days, but you will find examples of birth plans online. But keep it straightforward. We'll go through it with you and put it with your chart. And just remember, make sure to take into account that labour doesn't always go according to plan. So you need to consider what you would do if intervention is necessary.
intervention like a C-section.
Not necessarily. I mean, anything can happen on the day. It could be something as simple as changing your mind about pain relief. But the important thing is to be prepared and know you'll do your best. And we'll be here with you every step along the way.
Oh.
I think I'll have the chicken.
Oh, good choice. I'm going for the fish. Do you think it's okay to celebrate a little now?
I certainly hope so. I feel like I can breathe again. I really wish you could have been there though, at the ultrasound.
Well, it sounds like we're ready to celebrate. Oh, I love you.
I love you too.
We're gonna have a baby.
Yeah, that's the plan.
Is there anything you need? You know, vitamins, exercises, anything you should be doing to prepare?
Midwife said that all I need to do is eat sensibly and do some light exercise like walking or swimming. But no hoovering. She said that was right off the list.
Hoovering?
Yeah, you'll be able for that, won't you?
Aye, sure, whatever you need. Have you spoken to your mum?
Oh, for once she didn't mention about when you were getting the promotion.
It's coming, Bernadette, it's coming.
She wasn't too impressed about the midwives. She thinks doctors are perfect and she really doesn't get how much has changed. And she was on at me about work to take it easier.
Well, she's right. You should be taking it a little easier. You know, yes, I can do more around the house and I've already made a list of things we need to get for the baby's room. You know, I was thinking of painting it again. You know that paint you can get that doesn't give no fumes. Oh, and we need to get a breathable mattress for the cousin your court gave us. I've made a list of creches for you to check out.
Go. Slow down. You know what? Why don't we talk about this when we get a table? Alright?
Alright, but you know, some of the guys at work said you should be searching for these things as soon as you're pregnant, you know. If you're going to go back to work straight after the maternity leave, then we need to get this sorted. You know, one lad said we should be looking at schools.
Oh, come on. We don't even know what we're having. Can't we just enjoy tonight, right now?
Okay, you know, it's just I want to be there for you and make it easier. I want to be a good father.
Oh, you'll be a great father.
If you say so. Okay, will we order while we're waiting? You know, I am going to get beer.
I'd love a small glass of red wine.
Should you be drinking wine? You know, the book I read said anything that you put in your mouth goes straight to the baby. Have you checked if it's safe?
Checked it, yeah. I've talked to the GP, I've read all the books, and I think I have a pretty good idea of what's safe or what's not. I'm sorry, I don't want to start a fight, but I was there with my friends today, and suddenly everyone is an expert, and most of it is pure nonsense. Waiter. Yeah, waiter.
Well, you'd better watch out. You'd better think twice. There's lots of naughty things that you might realize.
I'm not a child, not public property. Don't you see this life is my responsibility?
Well, you have to think of the baby. Follow all the rules. 'Cause your body is a temple.
Everybody sits and watches everything you do. Please give me the credit that I'll use my common sense. Having wine with dinner's not a capital offense. Trust me with my body, I haven't gone insane. I am not a vessel, I'm a woman with a brain.
Well, you have to think of the baby.
just had my scan and they said everything was okay, and then they said that I was to go here and to check with the consultant, so.
Here's our mum-to-be. Now, you just take a seat and we shall see you in the day clinic.
Can you tell me why you're sending her to the day clinic?
As you are no doubt aware, certain new guidelines have come in dealing with how we assess risk here, and certain previously low-risk patients will be referred back to my care.
But they don't affect Evelyn, surely. She's doing really well. She's still low risk. There's no reason to change her chosen care path.
I wasn't entirely satisfied with her scan, and given her age, I think it warrants further investigation.
But her pregnancy is progressing totally normal. No risk level, no risk markers. You can check her chart.
I am right here, you know, you could just talk to me.
You, of course, are aware that I am the highest authority when it comes to the women here, and I shall be taking over the care of a number of these ladies. This is coming down the line, and you need to be aware so that you can be more realistic when managing the expectations of the women here. Now, let's get started. First, there's assessments, then we'll take your pee.
For a reason, it's nothing to see.
You just want me out of the way.
It's not like you have a say.
Hurry up, we've 100 more today.
First down the hall.
Up the stairs,
Then the left.
down the stairs,
To the right.
scan, blood, wait,
Back down the hall.
Make you wait.
do a test.
Don't worry, mother.
We have to be sure it's safe.
They have to be sure it's safe just in case.
It's all for the best for your baby.
I do care about my baby.
'Cause they don't really care about you.
Unless you sue. I think I would like to keep you in for a few more tests. Nothing serious, of course, purely for observation.
What? Observation? What kind of tests?
This is purely routine, dear. There are no problems with your pregnancy at present. However, this can change. In fact, we won't know entirely what level of risk you are until after the baby is born. And as such, I think I had better handle your care from here on out.
But you still haven't told me anything.
Do I have to go with him?
It's out of my hands. It's up to Mr. McGovern. The consultants tend to err on the side of caution when it comes to risk.
But I thought you were there to be on my side, to support me.
Look, I know this isn't what you wanted, but we are part of a multidisciplinary team. I'll still be here to see you and to support you.
Yeah. I guess I don't have any choice in the matter anyway.
Oh, you must be exhausted.
You've no idea how tired I am.
Well, did everything go all right? I mean, how is it with the wee one?
Everything's fine.
Well, that's good, isn't it?
Jesus. These appointments, I was waiting there for 5 hours. 5. I wanted to ask so many questions, but by the time they called my name, I was so tired I forgot everything.
Aye. Well, it's good that work are giving you the time off. I mean, you're getting paid for it.
The financial implications are not at the top of my list.
Oh, well, everything went well, eh?
The consultant didn't even look at me. He was just straight down on the examination table. I really miss being with the midwives.
Well,
At least they gave me a chance to talk and ask questions.
you know, okay, the consultant, he maybe no be good for a chat, but it sounds like he is giving the baby his full attention.
That's the problem, Michael. The baby is part of me. He should be checking that I'm okay too. I tried to ask him about my birth plan. He threw it out the window. He treats me like a child. Please, please come with me. I know he would pay me more attention if you were there.
Well, you know, Evelyn, that I'd like to go with you. There's nothing I want more than to be with you for the scan, but I've told you how the boss is getting thick with everyone. I don't know how I could swing it.
Please, just once. Hey, just call in sick one time. Please. I missed my name being called today because I went to the toilet. Please, it would be so much easier for me.
But then I'd have to take time out of work and I wouldn't get paid for it. But things are so tight, and with a baby coming, how am I supposed to swing it?
Michael, I can't do this alone. I can't. I'm worn out. I need your help. Please. At least come to the antenatal class. It's on at the weekend.
Of course I'll come to the class, okay? And I'll try and come to the appointment. I'll pull a sickie if I can figure out how to get away with it. I tell you what, if I'm not at the next appointment, I'll definitely be at the one after, eh?
Mammies and daddies to be, this is the delivery suite where you meet your precious little buns for the very first time. Our aim is to support you to give birth naturally, drawing on the tremendous resources of your own bodies to bring your child into the world. You and your baby will be well looked after here in this hospital. We'll be giving you information on everything that you'll need for the big day. Have you any questions?
What about parking?
Yes, we have paid parking here, so make sure to bring plenty of change with you.
What about classes?
Yeah, there'll be classes on washing your baby and...
Oh, and breastfeeding classes?
Yeah, breast is best. But we have twice weekly classes, so you surely catch one while you're in. But breastfeeding doesn't work for everybody, so we'll run you through the full bottle sterilising protocol as well.
Will I be okay to go to the bathroom? Will they be in the way, right?
We encourage the daddies to be at the birth. It's an incredible experience to see your child coming into the world. But remember, the gas and air is for mammies, so if you do feel faint, make sure to sit down and breathe. We also have a birthing room, which is available on request. But do remember, there is only one, so it might not be free on the day.
Fidelma, I was wondering, could I have a word privately? And I wanted your advice on my birth plan. I tried to show it to McGovern, but he just brushed me off.
Sure, let's see what happens on the day.
But should the consultant know at least look at the birth plan?
I want to have a natural birth, but with the way things are going, I'm afraid he's going to push me into something I don't want.
We'll see how it goes on the day. The best thing you can do is stay at home as long as possible once labour starts. The more you can do on your own, the less necessary intervention. Less need for unnecessary intervention.
But how will I know what's necessary or not? I mean, he's not going to listen to me.
You know, the consultant's a professional. He knows what he's talking about.
But I'm the one having the baby. I would like a say in how I do it.
As a midwife here, it's my job to help women to see birth as a natural process. But it's all about risk now. It's the consultant who decide.
So there's nothing more you can do for me. I have to fend for myself.
I'm sorry. That's the way. It's hospital policy. My hands are tied. I didn't have the against the powers that be. You just get through the day, keep your head down and do your work, collect your pay. You'll never have the clout, and they'll keep wearing women down and pulling babies out. This is the way things are, and though we've come so far, this is the way things are. It does seem quite bizarre. He is the superstar. This is the way things are. I once was young and new, ready to change the system. What could I do? You look wonderful. How did the scan go? Do you know what you're having?
Nobody tells me anything.
Why, what do you want to know?
Well, people aren't taking me seriously.
You're probably just hormonal.
Suddenly I have this life inside me. I seem to have disappeared.
Do you know, it isn't all about you, Evelyn, is it?
Baby's fine. Think I should be fine.
The baby's fine, that's the main thing. Tell me, how are you? Is your back hurting? Are you sleeping all right? I remember when I was pregnant on you, I couldn't sleep for the last month and I was tired and weepy. And of course, that's normal. It's what women have to go through.
I feel like I don't matter. I feel like I'm an incubator for this.
Have you spoken to Michael?
I have, of course. He just doesn't get it.
Michael will never understand. But Mr. McGovern is very good. Maybe you should speak to him.
Mr. McGovern doesn't listen to me. I was happier with the midwives. When I was with the midwives, I felt like I was the one having the baby, but now it's like I'm invisible and it's all about the baby.
That's why you need to listen to your doctor. There's a before and then an after when you're having a baby, and until then, you need to let the doctor do his job.
This can't be normal.
Do you know what your problem is, Evelyn? You're selfish. You always have been. Maybe that's my fault. I've always indulged you. But you know, it's time to cop on. You're going to be a mother, and one way or another, this baby will be born. So you just need to stop complaining. The most important thing is you have a happy, healthy baby. So stop whinging and let the doctor do his job.
Cervix certainly feels ripe. Let me try this one simple procedure.
Ouch! Oh! So what did you just do?
I just performed a sweep of your cervix. It's a little trick we have for getting things going.
Oh.
Well, all seems fine there, but on the balance of probability, things could get worse if we delay. Pregnancy is rife with pathology, but, Miss Eva Murphy, you play your cards right, you could go home with a healthy baby today.
Huh? I just came in for a checkup. I'm not due for another 2 weeks.
Better out than in, that's what I always say. Now, we shall bind you to a bed, blind you. Any complications, we'll ignore them until the baby is ready to come out.
Excuse me?
I said we will find you a bed, mind you. Do some evaluations to make sure the baby is ready to come out. Good, no nail varnish. Take off any jewellery. We don't want any delays if we have to section you later.
Wait, what section? Sorry, what's going on?
I think it's best we proceed immediately. Let's get you started. You're on the clock from now.
Oh, excuse me, could you get my partner? His name is Michael Byrne. He's in the waiting room.
Of course. Couldn't have the proud papa miss the main event.
Okay, he just examined me, but there's nothing wrong. Am I having the baby today? I want to go home. Take me home. Where's Michael?
Just do what you're told. It'll all be over soon.
They can't make me stay. I want to go home.
It's not about you. It's all for the best for the baby. You will stay put.
But I want my husband. I want my partner, Michael. Would you get him for me, please?
Jesus Christ. What's going on? Is everything all right? What's happening with the baby?
Sultan thinks I should have the baby today, but it's not right. It doesn't feel right. I want to go home. Just take me home.
Is it safe for you to go? Will they let you go?
I just want to go home. I can check myself out. I don't care if it's against medical advice to take me home.
But what if something happens? What about the baby? Anyway, the consultant knows what he's doing. If he says we should go ahead, should we not trust him? This isn't the way I thought it would be. I really don't know what I should do. I can't risk losing the baby or you. What do I know about giving birth in this situation? What am I worth? You want to go home, but I can't do it alone. I can't take the chance that I'd make the long call.
This isn't the way I thought it would be.
You're feeling scared, that's quite natural. But we are alliance and what's factual? They say you should stay, let's do it their way. If we leave now, what price would we pay? Let's keep our cool, play by the rules, follow the plan, we've no choice after all.
This isn't the way I thought it would be.
This isn't the way I thought it would be. This isn't the way. I've got to pack. Promise I'll be right back.
Push. Too soon. Do it again.
But I feel like I ought to push.
Wait till I tell you. You're doing it wrong. No wonder it's taking so long. Time's nearly up. Mr. McGovern will do what needs to be done.
Oh, please, just a little longer. Please, until Michael comes back.
Rules are rules. But sure, what does it matter? Would you get to go home with a healthy baby?
I feel like I'm almost there.
It doesn't matter what you feel. It's up to the experts now.
Tick, tock, tick, tock, tick, tock, tick, tock, tick, tock.
But I feel like I can push.
Push. Too soon. Try again. Time's nearly up.
Tick, tock, tick, tock, tick, tock, tick, tock, tick, tock.
Time's up.
Lights. Camera. Action.
No!
I saw the fluorescent lights glint off the sharp metal objects. Faces passing by, mouths opening, closing, asking me, telling me something. I'm underwater. I cannot hear. I cannot feel when the soft weight is settled into my arms. I sat there, in the middle of all that crying and screaming, bleeding here-ness of life. I looked at it, saw nothing. No joy, no fear. I was just another box to be ticked.
Of course, none of that ever really happens. We take good care of our ladies and ensure they get the best possible treatment. What you see here are the fears, the fantasies women have. None of this would happen ever in real life. Next!